I was born on the Rock of Gibraltar, and when I was growing up there was a dictatorship and led me to my interest in microbiology and infectious disease, all work in an interrelated ecosystem. The more we think about all our different senses, how we use those to communicate, I think the more trustworthy you become. Trap of saying that, data are the one truth. And data haven't changed. They're both accurate depictions.
You can see why you call yourself a storyteller as well as a medical affairs strategist.
That actually maybe healthcare at its essence should be more about collaboration rather than being a competitive endeavor. Now, instead of being an expert in your own medicine, now you're starting to become an expert in the healthcare system, and that now we were putting all this, I call it medical risk, onto people who were not scientifically or medically trained. The healthcare industry as a whole is still very siloed.
Things have got to change, right? The system is just not working.
You mentioned AI. I mean, what it doesn't yet have, right, to my mind, is a sense of purpose, of intent, right, and say consciousness. And what I mean by that, it was really not that it ignored rules and regulations, but it came up with the result that
technology is advancing much faster than a new way of delivery or innovating or new regulations or ethics even.
Putting those people in a position where they can truly make an informed decision. Be deliberately polemical, challenge the status quo, think coming to something better.
Well, hello, welcome. I'm your host, Zena Manji, and founder of INNOPATHWAYZ. I've spent over 20 years in life sciences industry working with med tech and startups, crafting strategies for new innovation. So welcome to the IPZO Facto podcast. It's a creative play on words on ipso facto, which means by the fact itself, suggesting something is inherently true or inevitable. So here at INNOPATHWAYZ, we believe that when it comes to innovation, there's no way but forward. The ipso facto episodes focus on innovation, strategy, transformative change in healthcare. And healthcare touches us all. But we don't need more buzzwords. We need bold moves. So we're bringing you guests all along the healthcare spectrum, including patients in upcoming episodes. So I'm really delighted today to bring to you Dr. Eddie Power here to the stage. Eddie, I have never met a pharma medical affairs professional that has touched such diverse areas as you have in the industry, and also including direct communication. So I'd love for you to introduce yourself to the audience and share what inspires you most.
Thank you, Zine, and great pleasure to be here with you and be able to share some of our thoughts and have a very nice conversation with you. So, Eddie Power, I'm the CEO and founder of a medical affairs consultancy called Empower Medical. So we're very boutique and very focused on that. I have 27 years experience in the pharma industry, primarily medical affairs, but I have had a couple of roles in strategic marketing and also in clinical development. And during those 27 years, I've worked for 6 different companies, both large and small. And prior to that, I was on the faculty at a London medical and dental school for 12 years. And that's where I started really getting into the whole area of communication, learning, and professional development. And when you ask me what inspires me most, I think it's that never-ending search for curiosity that I see in others, people looking for things that are going to make them better, going to help other people improve their lives, their experiences, and just that mindset of self-improvement, I think, is so inspirational from so many walks of life, not just healthcare, but anything else, media, sport, Even politics sometimes can inspire us, though sometimes it does become a little bit polemical. But if we seek inspiration, we can often find it in the places that we least expect.
That's such a wonderful introduction, Eddie. I feel like I've gotten to know you in kind of a special way with how you introduced yourself. It's not just this is what I do professionally and this is who I am, but really all the background that you come with. And that's so inspiring actually hearing your introduction. We recently met talking about, inspiration. We recently met in person at a Farmageddon event by Impatient Health. And I there we talked a lot about purpose
Mm.
was at that event, and you actually shared your purpose story, which was really fascinating and something I would have never guessed. A really unique background. So would you mind sharing with the audience your kind of purpose background, your purpose
Absolutely.
story?
Absolutely. Well, to start with, I was born on the Rock of Gibraltar. And for those of you who don't know where it is literally a rock uh, at the bottom of Spain. And when I was growing up there was a dictatorship in place at the time in Spain. So the border was closed. It's only 3 square miles. 30,000 of us were living there on top of each other. Good grounding for COVID lockdowns, by the way.
Yeah.
Um, but right across the straits is Africa, and it's only 8 nautical miles away. But you could see Africa there. We were fortunate to have a very robust healthcare system. The
Mm,
UK flew in medicines, provided medical care, but the only way we could get out was either flying to London, to the UK, or getting a ferry across to Africa. And Africa, to this day, was still devastated by infectious disease. And that's what
wow.
really piqued my interest. And for us living in such a small square mileage, hygiene and things that dealt with infection were often top of mind. There was a robust public health
Mm,
system. We didn't have fresh sources of water. Drinking water
wow,
had to be shipped in.
wow.
Um, so it was quite a unique experience, but it's what led me to my interest in microbiology and infectious
Mhm.
disease, just because of what I could see over on another continent that was literally within touching distance. And my purpose really grew from that we lived in such a privileged little world, but yet, like right across the way, there were people who were suffering, undergoing disease, didn't have access to the resources. And that's what led me uh, first to infectious disease. And my first position at the teaching hospital that I mentioned was as a course director for what was then called the clinical microbiology course. Um, but I still remember to this day my very first ever lecture to 300 medical and dental students on microbiology. I was so excited. I had spent hours putting together these slides that, by the way, then weren't electronic. You had to handwrite everything on overhead acetates to project to the students. And I thought I was crushing it. I was talking Escherichia coli this and Staphylococcus aureus that. And then within 5 minutes, I saw a paper aeroplane come out of the corner of the amphitheater. And within another 5 minutes, there were dozens of paper aeroplanes,
Right.
paper balls, and I'd completely lost the audience. And I was devastated. Went straight back to my professor back then and said, "Hey, I thought I'd done a brilliant job, yet I failed miserably." And I always recall his words. He sat me down and said, Eddie, he says, you just need to think about the audience and what their needs are, what their wants are, what are they looking for? And he said, 300 medical dental students, most of them aren't interested in infectious disease. They want to be surgeons, they want to be gastroenterologists. They need to know enough about something to be able to get them by and get them to qualify and get the certifications and the degrees, the diplomas, but they don't need in-depth detail in something that's not of interest. And I really took that to heart, which kind of evolved a lot of my purpose in how we communicate, and particularly in science and medicine, how well can we communicate, having experienced a lot of poor communication over
Mm.
my career. And to this day, Zena, I keep a paper airplane on my desk to remind me of that, and to remind me that whenever I'm communicating with somebody, that I understand what their perspective is, what their wants, what their needs are, and tailor that conversation and that communication to them rather than what to I want to communicate.
Yeah, that is a very unique background and experience, and I can see why you call yourself a storyteller, as well as a medical affairs strategist. And so, talking about your background and kind of the political situation and kind of those environmental external factors, right? When we're in pharma or any type of industry, you kind of do your role, but you never know when external factors are going to come. It could be a pandemic, which we all recently have experienced and still recovering from. It could be market issues. It could be any, political issues in any country or your own country, depending on where you're delivering care. And so with your specific experience, and you mentioned, although the political situation was as such a dictatorship, you said that the healthcare system was very robust. So I'm really interested in how you find, um, yes, it might be a provocative question, but how have you found the positives from that? Like how did that work robustly in your opinion? And is there anything from that from a healthcare system perspective that you think other countries could do better, like where you are now, for example?
No, absolutely. So two things spring to mind. One was that there was a lot of investment in education and improving, people's standards of education, and really
Mm.
trying to address and implement that at a population level. Um, but with that also goes a sense of community,
Mhm.
and the fact that within a healthcare system, it's not just about the individual, and it's not just about me first. It's
Mm.
trying to make sure that whatever you do or whatever steps you take are not only for your own good or benefit, but as you expand your circle, your family, your friends, and then the broader community. And for me, again, that was one of the reasons why infectious disease in particular was so appealing, because it's something that can be contagious, that can be spread. You can take measures as an individual that help protect others, vaccines being a prime example. But it's taking an accountability for your community as well as just yourself. And it's something that for me has always kind of driven me throughout my career. It's something that I think for all of us, that sense of purpose has to come from
Mhm.
within. You can't
Mhm.
have something external to you or to your beliefs provide that purpose. Sure, you can leverage, and I always think, work for six different companies. I definitely leveraged each
Yeah.
company to help me get to that purpose and to help me fulfill that purpose. But I never relied on the company for providing me with my purpose, if that makes sense.
That
Um,
totally makes sense. Yeah, that really resonates. And uh, I think you're also sharing that it's that individual, that personal rather purpose that creates an anchor, right? By which you can navigate changes or shifts as they happen, but you have a strong core of your own personal purpose.
Absolutely. And I think what it does, it also keeps you ready for the opportunity. We always talk about
Mhm.
change that may be external. It may be things that you can't control, whether you're in a pharmaceutical environment and your company merges or acquires somebody else. All my moves bar one through those six companies were through mergers and acquisitions.
Aha.
And it's not always being able to anticipate what's going to happen.
Yes.
I never liked the interview questions that said, "What's your 5-year plan?" Well, who knows, right? And um, and I fell into pharma really through serendipity more than anything else. But it's being aware and self-aware of the opportunities that arise through that change, and that then you become proactive about taking advantage of those opportunities, being able to challenge yourself, stretch yourself, and seize the moment.
Yeah.
And for that, you have to be bold, you have to be courageous. You can't be afraid of failure. You have to, if you
Yeah.
do fail, you have to embrace that failure and take the learnings, from that. Most of the major scientific and medical advances in history have come through failure. It's just that
Mm.
somebody had the nous and recognized that within that there was an opportunity to do something different that could actually lead to better outcomes for people, for patients, for healthcare as a broader whole. So that's going to be my guiding philosophy, ideology, if you like, and it's kind of what's fueled me through my 30, 40 years now in various sides of the healthcare environment.
Uh, uh, Thanks for that share. I think it's really powerful and empowering, which is leads us to your founder story as well. So, as you have gone through your journey of different all these various companies and these various roles, and as you said, um, some of these shifts were because of external happenings with company organizations, and I really love your advice on embracing change. I think oftentimes I've seen in shifts within the organizations that I've been in, sometimes people take a victim mentality
Mhm.
and become very negative because they feel like they've been harmed. And of course, we can't take away from the fact that, it is a difficult situation and everyone's going to meet the moment where they are. And it is hard to think, "Well, how are you going to overcome this hurdle?" But definitely, I think a more empowering way to tackle that is, as you said, is embracing that opportunity, see what you can leverage and how you can continue your journey with that, changing that challenge into an opportunity. Now, may not seem so easy at the time. So before we go on your founder journey, just say, would you say it's for yourself, it's like kind of what Steve Jobs says, you connect the dots looking back versus how did you feel in those moments?
Yeah, so for me, there were a couple of drivers that kind of led to that point in time, in my life, right, as
Mm,
well as career. What one is was working through different companies and at different companies. I had a growing sense that the way those companies thought and acted was very parochial, and by that I mean that they were very focused on their own medicines, especially if they still had patent life on them. And after end of patent expiry, some of those interests kind of faded away. Um, but I also had a growing sense, throughout my career that actually maybe healthcare at its essence and at its core should be more about collaboration rather than being a competitive endeavor.
Mm.
And by that I mean the more that you give a person, I don't like the word patient because it often boxes people into a certain framework and
Yeah.
can sometimes lead to a kind of victim type mentality as well. So I'm going to call it
Mm.
people who have some disease or some condition that needs addressing. But for me, the more choice that a person has when they're trying to address some healthcare issue or some healthcare event, then surely that's for the betterment of all of us. And if you kind of start stripping away that competitive element,
Mm.
um, then from a person perspective, that's a much better environment in which you have some choice. You can have different options. Um,
Mm.
so that had kind of been framing my thinking for a while, particularly having come from a teaching hospital environment where
Mhm.
very different approach to healthcare. And then I had the privilege in my last job to be responsible medically for one of the COVID therapeutics. And it was really, I mean, it was a unique experience for us all, but certainly in a farmer environment, here you had this disease that nobody knew anything about. There were no known therapies, no known vaccines, and we were kind of learning as we went, because for every other disease area that I can think of, even if you innovate and bring something better onto the market, there's still always some kind of standard therapy
Right.
behind that the healthcare medical community can fall back on. And this was unique and really privileged to bring a therapeutic to mind, because it was the one time where I think pharma and healthcare as a whole, governments too, can say we really did save millions of lives.
Mhm.
And to me, you couldn't within pharma. I felt that I couldn't get to a peak higher than that. And by
Yeah.
that time, I had been long enough at Pfizer. That was my last company that I was, vested in um, all my like retiree benefits, and I'd been there long enough and I was old enough, and it led me to think, well, I want to try something different, and something new. I want to be able to do things that interest me, that excite me, that actually take away some of those constraints of having to work within one lane or one channel, i.e., one
Right.
pharma company, and just being able to touch on things that I think can potentially make a difference. And that's what led me to found my company, and it's really led me to expand my network, to work with a number of brilliant people, brilliant minds in areas related to pharma. So things like artificial intelligence, tech companies, and just communications companies, which, as I've mentioned, is an ongoing passion of mine, and how do we communicate effectively. Um, and it's been quite liberating, honestly. It's been fun. Like we were touching on before, none of these journeys people should assume is always easy,
Yeah.
or a bed of roses. It's been tough at times, and you're taking out the certainty of being an employee with a
Mm.
regular income to something that actually isn't regular. Uh, but the rewards can be much higher. When I say rewards, I mean from a personal level, from an intellectual level, rather than a financial level, if that makes sense.
Yeah, totally. I hear you. And I think when we go on a founder's journey, it's typically, or maybe it's common, uh, to look at contribution. So you're kind of feeding that, how can I contribute to impact in different ways, uh, that you are the architect of
Mm.
as the founder, and whoever you have working with you. Um, so then really it gives you more opportunity to take on different types of work or different types of engagement than you typically would have been doing. So how has your journey now, uh what types of things maybe have you gotten involved with that you wouldn't in a typical role? And I think you've kind of highlighted yourself as a storyteller. You mentioned about communications, which, as we see, and which was highlighted at Farmageddon event as well by Inpatient Health, was trust, and how that is so important in communications. And you actually wrote a paper on that as well, so a couple of years ago. And so I'm really interested in your thoughts on um, what needed to be leveled up in terms of how we communicate, because I think what you were sharing just now in your journey and shifting to different companies, different roles, and on your founder journey, hitting COVID, and your background before is, and you're just right from the beginning when you were communicating to an audience about, depths of microbiology, and they're just not engaging with you in the way that you expected. So that has come to the forefront when it comes to communication in healthcare, both from a pharma perspective, from a clinician perspective, a healthcare professional, and now you in your current role and how you provide strategy and feedback. Could you talk a little bit more about? Kind of seems to me like you've broken yourself out. You've got a breakout role as a storyteller, and that creativity part of it. Do you think that that's something that you're now allowed to kind of create further versus what you were able to do in kind of those traditional roles? And then can you talk about those foundational shifts that you wrote about in your article on what actually needs to change? And I think probably putting that into practice since COVID, and now with AI and everything else, we have to keep looking back at how we're making that human connection.
Yeah, so one of the key shifts for me, I think, over my career, and what's led to what I'm doing today, has been an appreciation that we all work in an interrelated ecosystem,
Hmm.
and that there are a number of different actors within that ecosystem. That could be people, it could be process, it could be policy, it could be regulation. It doesn't really matter. But the
Mm,
more we think that how we operate within that ecosystem, and the different like needs, perspectives, wants of all the players within that ecosystem work and interact, the better it makes us all at understanding where the real needs are, where the real pain points are, where
mm,
the real problems are. If I go back to my time in medical affairs, to use an analogy, I always felt that within medical we were great car mechanics. And I use that as a deliberately provocative term. But what I mean by that is in the sense that we were very familiar and very expert in those cars we worked on, our
uh-huh.
medicines, our devices. We understood what was the best synthetic oil to use to drive them. We knew all the attributes, 0 to 60 in 3 seconds, or braking distance of 100 meters, whatever it is. We were great at that and being focused on that. What I felt and what I've come to realize more and more is that we didn't have a good appreciation of actually how does that car work in an ecosystem.
Right.
And 0 to 60 may be a great efficacy attribute in 3 seconds on a racetrack, but if you're driving in Manhattan, it's completely irrelevant. Um,
Right.
Whereas if you have really good working brakes, or your indicators are working properly, then that whole safety aspect becomes very relevant when you're driving in a city. But you don't need that if you're driving on a racetrack. And then beyond that, how does that car work with other aspects of that transport system?
Hmm.
Traffic lights, roundabouts, pedestrian
Hmm.
crossings. If you want to get to an island, do you get onto a ferry? If you want to get to the other side of the country, can you drive onto a train?
Wow.
So now you start behaving and thinking like a transportation expert. And if I bring that analogy back to medical affairs, now instead of being an expert in your own medicine, now
Hmm.
you're starting to become an expert in the healthcare system and that interconnectivity. And it doesn't matter if you're talking about a drug, or if you're talking about some kind of software solution or some diagnostic companion.
Hmm.
Is how is that going to be used? And is something that you've designed, say for hospital,
Right.
appropriate for somebody to be able to self-administer in the home, which is what was happening in COVID, right? A lot of
Mhm.
patients were being sent their infusion packs and they had to self-administer, or their caregiver had to self-administer. And I was acutely aware that now we were putting all this, I call it medical risk,
Hmm.
onto people who were not scientifically or medically trained. And how could we go about communicating what they needed to know to be able to use those medicines safely and effectively? Um, so it kind of ties back, to that communication. And for me, Zena, what it's done in this role, it's broadened, right, that lens and that network. We've got, be able to connect and interact with pharma companies, with solution providers, with healthcare practitioners, and kind of work with them to help connect all those dots together.
I really love that analogy that you mentioned about car mechanic and then, the overall transportation system. How do you navigate the roads? How do you navigate your vehicle through different situations, different climates, what have you. Also depends what vehicle you have.
Mhm.
The analogies are, I think, really good and can go broad, like tolls. Where do you pay a toll? Where is there a freeway? Uh,
That's right.
just access. Where do I have access? Right. I think that's brilliant and really easy, much more easier way to think about it. Like when I think about, being in conversations about the healthcare ecosystem, it just right away, I'm like, "Okay, this is complex. Depends who's talking from what angle." Not really clear about what outcome we're trying to drive because everyone's
Mhm.
in kind of their silos within that healthcare system spectrum. And, everyone has different agendas or different remits within that healthcare system. But I really love how you talked about collaboration and integration. And, you know, it's when we talk about treatments, whether it's a drug, whether it's a medical device or a digital therapeutic or whatever it might be, there's the way it's administered, but it's also, can the ecosystem actually provide access to that treatment, to the individual? And how is the individual interacting with that
Mhm.
treatment? Because ultimately, if that treatment is not put into action by the individual it's intended for, the benefits will not be realized. So it's a real, um shall we say it's kind of a holistic, or how would you describe this? It's holistic, broader view when you're delivering treatments and care, because you, of course, there's the safety and efficacy part of it. There's what is the healthcare provider or professional understand about it. Um, what does the reimbursement system,
Mhm.
um, how do they evaluate the treatment, and that goes to access, and then ultimately, which is probably one of the core things, is how is the individual then interacting with that treatment, and what is their experience? Is it a positive experience? Is it something that they can keep doing? What can be improved? And you mentioned during COVID, I guess there's some experimentation that had to occur, and a mindful medical risk taking, in that. So could you talk about how have you found or what are your thoughts on integrating all of that together when you're delivering care? And that more collaborative, integrated way, to actually have that direct communication and engages the the user on a personal basis.
Absolutely. I like simplicity, yet I tend to call all of that like systems thinking, and
Mm,
there's an element of futurism, right? And futures thinking as to,
mm,
what could be different in order to be better. And I think, when I think collaboration, the industry, the healthcare industry as a whole is still very siloed.
mm,
Pharma companies each talk and communicate about their own portfolios and their own medicines, devices that they offer, which isn't optimal at all for a person who's trying to seek information on what different, say, treatment options may be available, or for a healthcare provider for that matter, because you end up having to trawl through different proprietary drug company websites and then try and piece it all together. And for me, part of the future thing is, well, what if we
mm,
had a one-stop shop
mm,
where all of that information could be in one place for a person, for a healthcare provider to be able to access, and ask questions. And it means giving up a degree of control, right? It means
yeah.
that you probably need more transparency, right? In terms, not only of benefits, but also risks,
Mm,
of medicine's development. But you also, at least in the US, you've got that kind of silos on the provider and the payer side of things. With all those companies that I work with, I moved through 4 different states in the US. I had a different healthcare provider in each state. There was no communication between any of those, right? It was up to me if
mm,
I wanted to transfer transfer my healthcare records. Because I worked for 6 different companies, I had health insurance provided by 6 different payers.
mm,
They didn't talk to each other.
right.
And if you were already approved by one, you still had to undergo all these medical questionnaires each time you joined a new one. So, that whole fragmented system to me is ripe for change, and it's where that kind of collaborative mentality should come in. You know, and that's where kind of the future thinking comes in. Is it a hard task? Yes. Will we ever get there? I don't know, but surely we've got to aspire, to something like that because it can
Yeah.
only benefit everyone, right? People in care, the providers of that care, the organizations paying for that care, the policymakers, the regulators, and if we understand all those levers and how we can best get them working in unison and in the same
Yeah.
direction, then the better we'll all be for it. So aspirational, definitely. Practical, who knows? Probably not, but we need that purpose, right, to drive us to try and get there and take baby steps. If you can improve something one step at a time, then you're already on a good path.
Yeah, I think you're right. It does kind of take it is about futures thinking. It is about systems thinking. That's a great call out there, and I know something that you practice. And where I mean, things have got to change, right? The system is just not working, and we all feel that. Wherever you are in the healthcare spectrum, we're all receiving care at some point, and so we see things on the front line ourselves, and some of us are also creating those treatments
Hmm.
um, on the delivery side of things as well, or administrative side of things, or legal side of things. But do you feel, I mean, with AI coming is here, right? And with AI becoming more advanced and technology growing to advancing to such stages, every lots of people will talk about 2025 as kind of an inflection point. I guess when it comes to technology, they say that when you think about the industrial revolution, the digital revolution, all these different waves and revolutions we've gone through in the past. Now the the change will be exponential, where we are going to be seeing in a shorter period of time hundreds of years worth of advancements, where you can all already kind of see how, if you look at Gen Alpha, their lives are very different from what we experience. It's a whole different world, where I would say my life, and kind of broadly on day-to-day aspect and how things work, was not so different than how it worked for my parents, right,
Right.
who were
Right.
born in the 1940s. But now if I look at me and the next generation, a little bit difference. But now when you really start to see Gen Z, Gen Alpha, very dramatically different, where even as we learned at Farmageddon with the Gen Z panel, um, life purpose is even very different. Many are not necessarily looking for, I'm going to buy a house, I'm going to buy a car, I'm
Mhm.
going to be settled in one place, either because it may not be as easily accessible, or because roles are changing all the time, but even just the environment in which they're living is very different. And so you could imagine, if you're practicing futures thinking, um, and people having more of a voice. This probably maybe also futures thinking, but people who have more of a voice of how they are receiving care, and that such and such care is not good enough. Can that be a driver to bring in and force, or push, pharma companies and healthcare, um, clinicians, or practices, to say, well, I'm going to go over here because this particular practice engages with my digital tools and is seeing my data and engaging with my data on these tools in a day-to-day perspective, and I feel that this clinician, this physician knows me better, that's kind of a competitive advantage where maybe it's that selection, right? Um, that you talked about is maybe having more choices from that perspective. But of course, this is all complicated. Well, how does that work with an insurance? You talked about your own experience with different states. So it's also kind of hypothetical there, but I don't think it's out of the realms of reality completely, as tools and technologies increases. And you mentioned your own example that you experience with COVID, and because of a situation driving, well, you know, infusions have to be done at home. Now, how can we make that happen? Something drove that to happen, whereas probably it would have taken some more years before anyone innovated something to occur, right?
Absolutely. I definitely think that technology has always brought around change, and significant change. And even when you look at healthcare, there are surgeries that are done today that didn't exist even 10, 15, 20 years ago. There are people alive and walking around today living healthy lives that probably wouldn't have been alive without some of those technological advances. And for me, sure, I mean, you can acknowledge, right, the risk and there's potential downsides, but it's also looking at the opportunity and how you can harness them. With some of these new technology, you mentioned AI. I mean, it's certainly, and we're seeing it, right? It has the potential and the applicability to certainly speed up a number of tasks to make us be more efficient.
Mm,
What it doesn't yet have, right, to my mind, is a sense of purpose. I'm going to use the word purpose, of intent, right, and say of consciousness. And what I mean by
mm,
that, I was reading an article there where they task some AI tool to do something, and in essence, in order to get to what it had been tasked to do, it went off compliance, it ignored rules and regulations, but it came up with the result that it had been tasked.
mm,
So that's what I mean by
mhm.
consciousness, and by intent is making sure that we're aware, right, of the potential pitfalls as well as the benefits, and that we learn, to harness and use those technologies. And AI is the flavor du jour, but there's
Right.
more things that are coming. In cloud computing, come in and again transform a lot of the way that we've done business in the past. I mean, even as at a social level. And uh, we do see it, right? The next younger generations, I think, are much more accepting, we're going to say, and perhaps more trusting of some of these new technologies than
Mm,
perhaps some of those are. Or it's a different, priority for them. Again, just take my own personal example. I'm very cautious about what I do online. I have VPN set up. I have cookies blocked. I can certainly, like, speaking to my own adult children, they don't even think like that. They don't seem concerned about that. It's just part of the fabric uh, of
yeah.
of life and existence. So there's also, I think, a different perception of benefit and risk as generations, come through. I mean, when books first started being printed, they were seen as something bad and something that could influence people in the wrong ways. And you had the same with radio, you had the same with television, and it's been there, right, generation after generation. But I do think that that we can all learn from each other if we're open-minded enough, to think like that.
Yeah, exactly. And I think as change accelerates more and more, um, that opportunity to get used to, in a slow way, right? Um, it's it it's not going to be there, right? I mean,
Absolutely.
technology is advancing much faster than how we can figure out a new way of delivery or a new way of innovating or new regulations or ethics, even, right? When it comes to delivery of care, communications, or what you even develop as care, right?
Absolutely.
And so there are those things that require some mindfulness in when you mentioned it, what's the intention here? And looking at risk-based solutions or looking at technology in a risk-based way, I mean, it does require some experimentation. I do think companies are more open to experimentation than they were in the past. And I think partly that is driven by a competitiveness to be ahead. But I also think, how change often comes by in a successful way is because it's in the healthcare system. It's because it's helped to save. You mentioned save time, save costs. There's efficiencies built in. But let's shift here a little bit to this. Uh, since you're focused a lot on communications as well, on trust. So, with all of these changes happening, you went through COVID. Um, we have seen an issue of trust in how communication is received, how it's processed. How um, have you found tactics or ways of thinking or so kind of some of the suggestions you made in what you've written on how do we need to think about and practice communication differently to regain trust and also when something's new out there to actually acquire that trust and keep that trust.
Yeah, so there's a couple of different strands of thought, Zena. First is even when we think about communication, and often I think, pharma falls down on the kind of written word as a default, and with
Mhm.
maybe an animation or a graphic, but we communicate through sight, sure, we communicate through body language, we communicate through the way we present ourselves. Now when you walk into, say, a GP's office, they often have soothing music,
Yes.
ambient lighting, smell sometimes, right? They'll have some fragrance that's there. So the more we think about all our different senses, and how we use those to communicate, I think the more trustworthy you become, right?
Mm.
It's not just a one channel type of communication, but then it's also communicating in a way that people feel comfortable with. And too often, when I was writing that article, companies, not just companies, by the way, but the healthcare community as well, right, falls back onto, well, data are just numbers on a table or a bar
Mm.
chart. But actually, no, right? You can, like what we're doing now, we're actually looking at data all the time. We're looking at our expressions. You can collect and insights on mood, how somebody's feeling, and you can even put that together over time, right? If people are on the phone,
Mhm.
or videos or selfies, and put together all that to actually give you a journey of progress of a person who's in an intervention. Are they more active? Are their expressions changing? If they were in pain, are those expressions now suggesting that that pain's improved?
Mm.
Um, so, and each kind of stakeholder will probably want to get those data right in a slightly different way. And we're talking about Gen Z and the newer generations. Well, TikTok's all about expression,
Yes.
right? And a visual. It's not about here's another table that I'm going to show you. And by the way, I know you can't see the numbers. I'm going to put a little red circle around it, and that's what I'm going to focus on. Why do you need all that? Periphery to it, right? It's just getting to that
Yeah.
particular message or point that you want to communicate that's relevant to your audience. So thinking like broadly like that, when COVID was happening, healthcare providers surveyed said that most of the information of COVID came from the New York Times or
Hmm.
the BBC because they had very succinct animations and graphics that allowed them to
Mm.
understand what this disease was. They didn't want to read a 20-page scientific publication. They needed to know enough to be able to recognize what it was and to be able to manage it or refer it on to specialists. So that infectious disease physician, sure, may have wanted that scientific publication. But for your average general practitioner or somebody in urgent care, those learnings from media companies, in essence, were so powerful, and got to the purpose, which was really at that point to save people's lives, right, who were suffering from COVID. So those, are some of my thoughts. In an ideal world as well, Zena, and talking specifically about pharma and medical affairs,
Mm.
I am a strong advocate that you should be able to have an interaction and talk about any medicine or any device that's relevant to the disease area that you're engaging on. Doesn't matter if it's your companies or not. If you're really going to have a meaningful and constructive conversation,
Yeah.
whether with a provider or with a person who's in care, having that lens makes you much more credible and makes you much more trustworthy, right? Because now you say, well, here's all your different options, and here's the benefits of A versus B, here's the risks with C versus D.
Yes.
And now you're putting those people in a position where they can truly make an informed decision, right? It's not just
Yeah.
here's information on my drug and you're going to get it, and I'm not going to talk about anything else. But so that to me again, it's also aspirational, probably, but
Mm.
it's more, I think, of a space and a place we should be trying to get to in order to create that trustworthiness.
Yeah, absolutely. And I think it comes down to exactly what you're saying. If we're delivering healthcare and as individuals we're receiving healthcare, what does it all come down to? What action needs to be taken? And how do I or how does the individual make that decision? Right? And many times you don't have a lot of time to read things or understand how it interacts with everything, but you might be suffering from a condition or maybe trying to prevent a condition where
Mhm.
you actually want to be in action, and understanding that in a more holistic way and what the overall options are can only make the healthcare experience better. And, during COVID, I did hear some company CEOs, or in this case, the media was, in this context, the media was trying to create competition. But it was interesting that there were some CEOs that were saying, "Well, I hope others are also working on some of these things because we've got billions all around the world who need to be served during COVID. So all hands on deck. It doesn't matter where you are, and we're not really afraid of competition because as one company, you can't serve them all. So it's going to
Right.
take all of us."
Absolutely. And there may be, like in cases like that, alternative types of business model, right? Imagine if all
Ah,
companies
yeah,
pulled the resources and put everything into one pot, and if you came out with two or three different, say, therapeutic options, fantastic. And each company could take a percent of that, regardless of who was the originator, right? Putting that into a pot, but for the benefit of humankind. To
yeah,
me, that would be a really good collaborative, example. And it's also starts getting you away from this kind of volume based approach, right? That it's volume, more sales, more revenues, more
yeah.
of that. And what if you had like Netflix, a subscription type model, regardless of how much of your medicine is prescribed or administered? Then it starts taking away a lot of pressure to market, to sell, but you can start providing some resources that actually help people get to informed decision making, right? And support them in their journeys, and really have a deep dive into the whatever disease area or whatever the time to prevent is. I mean, imagine a world like that without those pressures.
Yeah, exactly, and I've mentioned this in another episode, but I'll say it again, talking to someone in medical affairs is, I recently learned that it was 1,000 years ago that Ibn Sina or Avicenna, this Latin version of his name, came up with the, I think, called the Canon of Medicine
Mm.
in 1025, and a key part of that was prevention. And now you see where we are 1,000 years later. Wonder where we'll be even 100 years from now, right? Because
That's right.
between 1025 and 2025, it's quite possible that level of change could happen in 100 years or maybe even less from now.
That's right. That's
And and more and more people wanting to know what's happening in their bodies and with their condition, but also the technology allowing individuals and healthcare professionals to have a more immediate, or more and more immediate, um, realization of the results. Is this working? Is it targeted for the right individual, or should we shift to something different?
Yes, and you'd mentioned earlier, Zena, right, that having people, patients, like more empowered and sharing in the truth. That I think there has to be a recognition as well that not not every actor in that has the same goals, right? If
Mhm.
if I'm put on a statin and my HCP might be focused
Mm.
on my cholesterol levels, right? Or my payer or employer might have an incentive for me to eat healthier. They could give me a discount, right, on my healthcare premiums. But my purpose might be, kind of have a cheeseburger once a week, as an example, right? But
Yes.
they're all, I think, valid objectives, right? In terms of
Yeah.
our healthcare. The regulator may have a completely different objective. And sometimes I think we get like
Mm.
too focused, like even in pharma, on cure, where sometimes it's maybe quality of life that's more important. Um, you know, we're both wearing glasses. I'm short-sighted. I'm not looking for a cure, but I wear my glasses because the quality of life improvement is fantastic, right? Um,
Yes.
but that's my goal. I'm not seeking a cure. Now, sure, there's technologies now, right, like laser technology and things that may lead to a cure, but uh, that's not what I want, right? And
Yeah.
I'm happy. My objective is to wear spectacles because it improves my quality of life. And it's just that there's things that we often take for granted, or even the way unconscious bias in the way we think
Mm.
that we don't often take into account. Um, in healthcare, and we often fall into the trap of saying that data are the one truth,
Yes.
right? And to give you again, I'm going to use another analogy for this. I was brought up with a world map that had the UK right at the center, and the Americas were west, and Asia was east.
Hmm.
If you go to some of the maps that are used in Asian countries now, America is east instead of
Yes.
west. The facts and data haven't changed. They're both accurate depictions, right, of the world,
Yes.
but the perspective and the context in which you're viewing those facts and data are very different, right?
Yes.
The context that we often don't realize, um, like when we're communicating, when we're providing information, it's always worth thinking about what context is my audience looking at it from. And if
Yes.
I understand that, then I can be much more effective and providing them with something that's relevant.
That's brilliant, Eddie, and it's reminding me of my own personal experience where I had a condition and I was discussing with my healthcare professional, but I knew that I was gonna have to be put on this medication, which has very strong side effects, and I didn't want to be
Mm,
on that medication for 6 months, and so I just discussed with my healthcare professional to say, I don't want to do that." And I suggested, "Well, how about this? How about we take a more aggressive, um, physical treatment and where the medication can be more targeted, and could we then have less of a treatment, duration
mm,
on the actual drug?" And it actually worked. So I think that's really brilliant, Eddie, because even though I did that, I didn't really realize that that's what I was doing until you mentioned that. So I think for everyone listening, take that agency to have that conversation, just because what is being said to you about a treatment or a procedure is given to you in a certain way, that doesn't mean there aren't other options. And look at what you brilliantly stated, Eddie, is your own personal context and what's meaningful for you, what is going to help you in your life, and what's the outcome you want. And that means you're also individually thinking, okay, this medication and treatment might have a regulated benefit and risk, but I have my own benefit and risk
mhm.
that I'm looking for. So let's discuss that, um, data that you have on this treatment and medication and procedure in the context of what are my own personal goals.
Absolutely, absolutely. And I think you used the right word there, right? It's having that agency, right, and the confidence in your own agency, to be able to have those conversations, and to make the decisions that are right for you at the end of the day. We're all individuals with our own kind of needs and wants. And that really should be the driver.
Yeah, absolutely. So, Eddie, this has been such a wonderful conversation with you. I learned a lot, and I'm sure the audience saw different perspectives on how you look at healthcare. And also, yeah, there's an admitted need for a change because what there is today is not working. But it does take all of us, as you said, as collaborate, to integrate, kind of look at how do we use that systems thinking and future thinking to really make an impactful change. And wherever you are in your career, embrace change and really go forward with looking at opportunities and challenges being opportunities and aligning that with your purpose. I think you've beautifully shared that through your story. But as a wrap up, I'd like to ask you, Eddie, um, what do you see as today as maybe or a critical challenge or problem that you see needs to be solved, and how how is the work, if you could talk a little bit about your company and how you focus on these things?
Yeah, so for me, it's the challenge is still, and we've touched on it, is still having that communication that empowers people to be in a place where they can make decisions that will improve their own lives. And with part of that, I think there's that curiosity factor that needs to be there. We can each challenge ourselves on being curious, every day. Next time you walk down the street in a city, look up, look around you, have a look at the architecture you maybe have never looked at before because you're just focused on getting from A to B. If you live in an area that's more rural, look around you and look at the way that birds, animals, fauna, flora interact with each other and how all of those systems work together. And then take that mindset, take that kind of systems mindset with that curiosity to challenge ourselves. And a lot of that kind of work that I do, that we talked about at places like Farmageddon, is to be deliberately polemical,
Yeah.
challenge the status quo, think against orthodoxy, think against doctrine, not just for the sake of it, but with the purpose of actually coming to something better. And I think if we all practice that in our daily lives, it just makes us, much better human beings for the good of all of us.
Such a wonderful conversation with you, Eddie. Thank you for joining us here on this podcast today, and I was really enjoyed talking with you and getting to know you better.
Likewise, Zena, thank you for having me.